Would you let him punch you in the face for $1 million?
Tyson's a different dude now. He's a kinder, gentler Tyson.
What about 20-year-old Tyson?
Hell no. So the bad news, he's probably out for the rest of the season because 6 weeks puts him out for the rest of the season. The good news is the Giants suck anyway, so it's not making much of a difference. Actually, I'll take that back. In the NFC East, they can still make the playoffs.
I got bones. I got bones. I got 206. I got 206. I got
Daniel Jones. Wow. Yep, that's a hamstring injury. So hamstring injuries usually occur in, I should be looking at the camera. All right, so hamstring injuries. So hamstring injuries usually occur in running athletes, and they usually occur when the hip is flexed and the knee is extended. So when people are taking off, for example, okay? So if you look at that clip, you see that he was running, and he suddenly clutched the back of his thigh, okay? Because that's where the hamstrings are, that's where it hurts. So they're most commonly seen in rapid acceleration sports, soccer, football, anything when you're trying to run. In football, you're trying to run so that you don't get your butt handed to you. That's why quarterbacks run. You also see hamstring injuries in water skiers, like this guy. So if you look at the clip, he was running, clutching the back of his thigh after he was running. That's classic of hamstring injuries. So how does it happen? What's the pathophysiology? Okay, as we said, this happens in running athletes. So sudden accelerations, especially when the hip is flexed and the knee is extended. So remember that water skiing guy? See his hips flexed, okay, knees extended. Have you ever been water skiing and the boat's pulling you up, or you're trying to keep yourself from falling over? Your hips are flexed and your knees extended, and just like that guy, okay? So there are 4 muscles in the hamstrings, the so-called hamstrings. The semimembranosus, the semitendinosus, and the short and long head of the biceps. So these muscles, the hamstrings, cross 2 joints. Okay, it's kind of interesting. Not a lot of muscles do that, but they cross 2 joints. This is why when these injuries happen, they happen because things are happening across 2 joints. Remember, the knee is flexed and the knee is extended. Like I said, usually the injury occurs at the myotendinous junction, but it can also occur at the attachment site. So you can have an avulsion of these muscles off the ischial tuberosity. Okay, you usually see that in skeletally immature individuals, so people who have not stopped growing. So high school athletes, maybe some college athletes, but most of the time college athletes have are grown-ass men, especially in the SEC. So if you notice, he got hurt, he grabbed the back of his thigh, but he still went back and tried to play for a little bit, and then he got off because he couldn't do it anymore. So he may have had a tear that got worse, or he may have had a tear that went to a complete tear. We don't know yet. Presentation, what we call presentation in medicine, means how does it happen, or what do you see when a person has this injury? Again, sudden acceleration. They probably tell you they felt a pop in the back of their thigh. That's that musculotendinous junction kind of stretching it into tear. They may have a bruise at the back of their thigh. If they have a complete tear, they might have a big ball of muscle because it's all balled up after it tears. When you touch them, when you palpate them, it'll be sore. Or you can feel that big muscle bulge or the muscle ball if they've had a complete tear and everything's all balled up. When they walk, they're going to have what you call a stiff-legged gait because they're trying not to flex their hips, they're trying not to flex their knees. So as you can see in that clip, he's grabbing the back of his thigh and he's kind of limping along doing this. That's stiff-legged gait. That's what you see when people have a hamstrings injury. You guys remember the 92 Olympics? Derek Redmond, I think his name was. Derek Redmond, yes. British runner, 400 meters, tore his hamstring. Look at this. That hurts. And I think he had a complete injury. But this guy's a champion. He wanted to complete the race, and he did, with a little help. I don't think they're going to let a quarterback have somebody helping him out like that during the game. How do you test for this? Well, first the person's going to tell you what happened. You can see the mechanism of the injury in this player. He'll probably tell you he felt a pop. You can palpate it. He probably has a bruise there. Or he may have a bunched up muscle there from where it completely tore apart. Then there's a couple of tests they can do. One test is to sit down and reach for your toes. That'll stretch that muscle. It'll hurt. The other test is to have you lay flat on your back, flex your hip 90 degrees, flex your knee 90 degrees, and then extend your knee slowly or passively. So that'll cause the pain. The other test, and I'm not sure why anybody would do this, is to do the same thing, but you do it rapidly. That'll get you off the table. But if you already did that passively, kind of slowly, why the heck would you do that to somebody? There's some pretty sadistic orthopedic surgeons out there. Hopefully he doesn't go to one of the Cowboys doctors. For this guy, he's going to get an MRI. They're going to see the tear probably at the musculotendinous junction where there's going to be a lot of fluid. MRIs look for fluid, so you'll see that where the injury is. Or they could be a complete tear and you'll see the muscle bunched up. So what's the treatment? Rest, ice, non-steroidal anti-inflammatories, and just wait. It usually takes about 4 to 6 weeks. But you only return to play when your strength is 90% of what it was pre-injury. Otherwise, remember, you can re-injure this. That's the risk factor, previous injury. So return to play when your strength is back to 90%. So it takes about 6 weeks. Then you have to build the strength up. So it might be even longer than 6 weeks. 6 weeks to heal. Then you have to build the strength up. Otherwise, you risk an additional injury. If it's completely ruptured, if you have a complete tear, then you operate. And that is not a good position to be in because you'll never really have the same strength as you had before if you had a complete tear. What are the outcomes? 80% return to pre-injury level at 6 months. That's a long time. But with surgery, there's a high rate of complication, about 23%, it's more than 1 in 5. For the injury of the myotendinous junction, you kind of sew it together. If it's a bony avulsion, they put suture anchors, sew it to the tendon, and they reattach it and let it heal. Okay? I don't think he has a complete tear. I think he probably has partial tears, and he's a high-level athlete. So they're going to do something called PRP, platelet-rich plasma. That has all of these growth factors that allow things to heal faster. He's probably going to get ultrasound treatment. He's going to get some nice massages, and he's going to get some time to heal. But I think he's going to want to take some time off and heal before going back and trying to injure himself again and affecting the rest of his career. Remember, these high-level athletes, the thing that separates the really good from the good is just that much. So why take a chance of not completely healing before going back and risking injuring himself? That's what I do. Not that I'm a professional quarterback or anything, but the Broncos did call me this weekend. Anyway, hamstring injuries, I think he's done for the season. He'll be back next year. But like I said, the Giants aren't that good anyway. But they still might make the playoffs. See you next time.
I got bones. I got bones.